This video presents healthcare barriers experienced by breastfeeding immigrant mother in Saskatchewan, Canada. Dr. Sheila Harani and her team acknowledge the support of Saskatchewan Health Research Foundation that funded this study. We acknowledge that there is no actual or potential conflict of interest.
In healthcare settings, I feel that there is a discrimination and racism. The way healthcare providers look at you makes you feel that you are not one of them or different from them, and they deal with you differently, maybe because of your accent. They give me the feeling of neglect. Sometimes they undermine your ability to talk or have knowledge about a certain thing.
As a Muslim woman, my preferences in the healthcare setting were halal food, privacy to breastfeed, and breastfeeding counseling by the female healthcare providers. Unfortunately, my requests were not accommodated. My doctor was a male and I did not feel comfortable talking with him about my sore cracked nipples.
During my hospital stay, the worst thing was the shared room having no privacy. There were 4 beds in a hospital room. Due to lack of privacy, it is challenging to breastfeed, especially for a woman who has just delivered a baby.
I felt that the healthcare providers in the hospitals were not encouraging. Because of this, I was about to give up on breastfeeding. I wish they were more encouraging. In healthcare settings, the healthcare providers just tell you that breastfeeding is good. But they don't know how to support you more. I felt that they have limited breastfeeding knowledge and expertise. I felt all my clinic visits were very short and all my questions were not answered. Most of the time there were no interpretation services in the healthcare settings. It would have been helpful if the healthcare providers explained me about breastfeeding and offered timely support. My baby stopped breastfeeding and I couldn't breastfeed again as I didn't get any support or guidance on breastfeeding. I often received formula samples from the doctor's office.
I wanted to talk to a breastfeeding consultant, but there were no lactation consultants at the hospital. If they were available, they would make me save my milk, discover the tight tongue problem in my baby, and prevent the clogged duct from happening. Having breastfeeding advocates such as a breastfeeding consultant at the hospital is essential, as they have the needed knowledge to avoid and solve problems.
Immigrant mothers recommended for the healthcare settings where there is no racism, cultural sensitivity, privacy and infrastructure for breastfeeding mothers, encouragement from the healthcare providers, availability of lactation consultant and knowledgeable healthcare providers, adequate breastfeeding support and care in different languages, and breastfeeding advocates that support baby-friendly initiatives.
We need quality healthcare and lactation support to sustain our breastfeeding practices.